In healthcare, I'm not sure that large hospital healthcare systems like ours thought of themselves being as involved in the business community until maybe the last 10 or 15 years. We are large businesses. It's a different business model. But we have locally and on a state basis, and now more nationally, gotten involved with business coalitions, with other business leaders to advocate for things at state and national levels. So I would say that as healthcare providers, we're relatively new to this game, but realize the importance. We also often have a voice that when we come together with other businesses, we add to that voice and add texture to the discussions that we can have with governmental leaders. So I think it's critical that my part of the business industry, that is healthcare, gets more proactive in these discussions. In healthcare, we are very subject to decisions in Washington. And those decisions can change very quickly. Recently, we had the sustainable growth rate fix on the physician side and had some surprises in there on some delays of implementation of going to what we know as ICD-10 or a coding product. We have spent hundreds of thousands being ready to do that for October 1 this year, and then Congress, with a sweep of the pen, delayed that for another year. So literally we have wasted hundreds of thousands of dollars within one health system just in preparation for something they changed very quickly on one bill. So that's a terrible way for us to have to spend our time, is reacting to what may or may not happen on any given day on the Hill or in Washington. And it's not just legislatively, it's also within the executive branch, within the governmental payers, Medicare, Medicaid. So we're subject to a lot of those changes, and it can drive us crazy. Again, sticking in my area of expertise in healthcare, it's driving me crazy that we're not having discussions about healthcare policy. We're having partisan bickering and not sitting down and really trying to figure out solutions. It frustrates me that candidates are either running on throw Obamacare out or keep Obamacare, but we're not having any discussions of how to take what is now policy and is now law and make it better. We're just saying, just throw it all out and start all over again, which I think is absolutely crazy on the Republican side without having a plan of their own. So we have got to force, we, citizens, business, healthcare community, force our leaders in Congress to start talking to each other and start having dialogue on these issues.